Imagine this. You're maybe halfway across the world, exploring somewhere totally new, maybe feeling a bit off, and then suddenly, bam, you really need medical help. Now, finding your way around a hospital is tough enough in your own language, right? But doing it in a foreign language when you're already feeling vulnerable, maybe confused, that's a whole different challenge. So today, we're doing a deep dive into something really practical. How to communicate effectively in a hospital when English isn't your first language. Or even if it is, but you're just feeling overwhelmed. We've got some fantastic, really practical info based on resources about English for medical situations. Our mission is basically to pull out the absolute must-know stuff to empower you when you really need it.
That's exactly it. We're not just going to read definitions. The idea is to give you those key phrases, the core understanding you need to cut through the stress and confusion. It's really about making sure you can express what you need. Building that communication bridge so your voice gets heard clearly and hopefully calmly.
Okay, let's start right at the beginning. You're walking, maybe you suddenly feel dizzy, a friend calls for help. That first word you'll probably hear or need is ambulance.
Right. The ambulance is that special van, the vehicle designed to get sick or injured people to the hospital fast. A really common example might be we called an ambulance because my grandfather was having chest pain. Just knowing that word and knowing it's for emergencies is step one.
Okay, so the ambulance gets you there. Once you arrive, who are the main people you're likely to interact with? There seem to be about, three key roles?
Yeah, three core roles. First up, the nurse. Think of the nurse as often your main contact point. They're medical pros who do a lot. Giving medicine, checking your temperature, blood pressure, assisting the doctors, and honestly just helping you feel a bit more calm and informed. Like someone might say, the nurse was very kind and helped me stay calm. They're really vital. And then, of course, there's the doctor. The doctor is the person who figures out what's wrong with the diagnosis and decides on the treatment plan. They're making the key medical decisions. Might hear something like, the doctor told me I had a minor infection and gave me antibiotics.
And in this whole picture, you are the patient.
Exactly. A patient is just the term for someone receiving medical care. Knowing this just puts you in the context you're the person they're focused on. You might hear staff mention there were many patients waiting in the emergency room. Simple word, but it defines your role there.
And there's a good little story to illustrate this, right? Like Anna in London, she falls, hurts her ankle, an ambulance comes, a nurse helps her at the hospital, maybe with a form, then the doctor checks her foot. Anna's nervous, naturally, but the staff helps out. It shows how those roles work together right from the start. So you're past that initial arrival, you're actually inside the hospital building. What happens then? Where do you usually go first, and what info do they need?
Okay, so you'll almost certainly end up in the emergency room, or you'll hear it called the ER. That's the specific area for urgent, sudden medical issues. It's where you go for immediate attention, like he was taken to the emergency room after the accident. The thing about the ER is it's often about speed and prioritizing, sometimes called triage.
And one of the first things you'll probably deal with is some paperwork, right? A medical form.
Yes, the medical form. It's really important. It asks for your personal info name, address, birthday, but also crucial health history. Stuff like allergies, current medications. Think of it like, I filled out a medical form with my name, age, and allergy history. The key is, fill out what you can. If you're stuck, definitely ask for help. Simple and clear is best.
Right. After the form, the focus shifts back to you while you're there. They'll ask about your symptoms.
Symptoms, yeah. Those are the signs your body's giving you that something's wrong, like pain, feeling dizzy, having a fever. The doctor will definitely ask, what are your symptoms? Then, after they gather info, maybe do some tests, they'll provide a diagnosis. That's the medical term for what they think the problem or illness is. For instance, after some tests, the doctor gave me a diagnosis, pneumonia.
And if you need medicine to treat that diagnosis, you'll probably leave with a prescription.
Exactly. A prescription is that written order from the doctor for a specific medication. You take that piece of paper, or maybe it's electronic now, to a pharmacy. Like I went to the pharmacy with my prescription to get antibiotics. It all connects pretty quickly. You might have a quick chat like, nurse asks symptoms, you say sore throat, high fever. Doctor says, okay, sounds like the flu. Here's a prescription. Symptom, diagnosis, prescription.
Okay, let's unpack this a bit more. You're inside, they're asking what's wrong. Being able to say how you feel, that seems absolutely vital.
It really is. And often the most basic feeling is pain. Just that strong, unpleasant sensation. It's good to have simple ways to describe it. You can say things like, I have a headache, or my stomach hurts. If it's specific, maybe there's sharp pain in my back. Or relating to function. It hurts when I breathe. And don't forget general feelings like, I feel weak and tired. Being specific, even with simple words, helps them a lot.
And it's not always just pain, right? There are other common symptoms people need to describe.
Definitely. A big one is fever. Your body temperature is too high. You'd say, I have a fever. I think I caught a cold. Then there's nausea, that awful feeling like you're going to vomit or throw up. Someone might say, I felt nausea after eating bad seafood. And a really common one, sore throat. Pain when you swallow. My throat is sore. It hurts when I swallow.
That raises a really good point. When you're stressed, maybe in pain, trying to use a foreign language, what's the most important communication tip?
Keep it simple. Seriously. You don't need fancy medical terms. You don't need to say, I suspect I have acute gastritis. Not just say, I have stomach pain or my stomach really hurts. That's clear, direct, and gives the doctors exactly what they need to start figuring things out. Simple words are powerful here.
Okay, so you've managed to describe your symptoms. What usually comes next? Doctors often need more information, right? Tests.
Exactly. Tests help them see what's going on inside or get more detail. Two very common ones are the X-ray and the blood test. An X-ray uses radiation to create images of the inside of your body, especially bones. So they took an X-ray to check if my arm was broken. It's a classic example. And a blood test is where they take a small sample of your blood to check for all sorts of things, infections, the levels of different substances, general health indicators. You might hear the doctor ordered a blood test to look for infection. These are really standard diagnostic tools.
And sometimes medicine isn't a pill, it's given more directly.
Right, you might get an injection or a shot. That's just when they use a needle to put medicine directly into your body, maybe into a muscle or a vein. A very common example everyone knows is like, I got a flu shot last week. Sometimes it's for pain relief, sometimes it's antibiotics.
Okay, so tests, maybe injections, all of this leads towards the treatment, yeah.
Yes, treatment is the overall plan, the care you receive to get better. It could be medication, could be rest, could be therapy, could be surgery. It covers everything. So, the doctor said rest and antibiotics are the best treatment. Is a good example of describing a treatment plan.
And while you're telling them about symptoms, there's one piece of information that's super, super critical to share, isn't there? Allergies.
Absolutely critical.
Yeah.
An allergy is when your body reacts badly to something specific. It could be a food, a medicine like penicillin, dust, anything. You need to tell them. For example, I'm allergic to penicillin. This is non-negotiable. Always, always tell the doctors and nurses about any allergies you have, even if you think it might not be relevant. It could be life-saving. Repeat it if you need to.
Okay, so let's quickly recap the flow with another little story example. Mark feels unwell, right? Sore throat, high fever.
Yeah, so Mark goes to the hospital. They ask his symptoms. Maybe they do a blood test. The doctor gives a diagnosis, say a throat infection. The treatment might involve antibiotics, maybe an injection for the pain or fever. He rests, takes the medicine, and feels better. It just shows how these terms all fit together in a typical hospital visit.
But sometimes it's not just a quick visit. You might actually need to stay in the hospital for a bit, maybe a few days.
Right, that can happen. If you need ongoing care, you'll be admitted to a hospital room. That's your space. Could be private or shared during your treatment. Someone might say, I stayed in a hospital room for 3 nights. While you're there, you might have visitors.
Visitors, friends, or family coming to see you.
Exactly. Pretty straightforward. My friend came to visit me in the hospital, and during your stay, you'll notice the staff are very focused on hygiene. Hygiene just means keeping everything clean to prevent infections. You know, the nurse cleaned the room and changed the sheets. It's a constant process in hospitals.
And the goal of staying in the hospital ultimately is getting well enough to leave. That's called discharge, right?
Precisely. Discharge is the official word for when you're allowed to leave the hospital because your treatment there is complete or you're well enough to recover at home. You'd be happy to hear, "The doctor said I'm ready for discharge tomorrow." It's that final step in the hospital part of your recovery journey.
Okay, this has been incredibly helpful. And to really empower people, there are some key simple phrases that anyone can use in a hospital, aren't there? Kind of like verbal lifelines.
Yes, absolutely. Knowing just a few direct phrases can make a huge difference when you're feeling unsure. Things like, "I need help." Just simple and direct.
Or knowing where to go. Where is the emergency room?
Describing a serious symptom. "I have chest pain." That gets attention fast.
Asking for the right person. Can I speak to a doctor?
Questioning medication safety. Is this medicine safe for me? Especially important if you have allergies or other conditions.
And managing expectations. How long do I have to stay? These are clear, simple ways to get vital information or assistance. So what does this all boil down to? We've taken this deep dive into some really crucial hospital language. We've looked at the key people, doctor, nurse, patient, and the ambulance getting you there. We covered describing how you feel symptoms like fever, nausea, sore throat, pain. We talked about common tests like blood tests and x-rays, and treatments like injections and prescriptions, and even what happens if you need to stay right up to discharge.
And I think the biggest takeaway, the most empowering thing really, is something we touched on but is worth repeating. You don't need perfect English. Not at all. You just need to be clear and, if possible, calm. Use those simple words we talked about. Short sentences are fine. And please, don't ever be afraid to ask for help or say you don't understand. Being in a hospital, especially abroad, is naturally scary. But knowing you have some words, the right words, means you can speak up for yourself. And your voice definitely matters, especially when it's about your health. Which maybe leads to a final thought for you, the listener, to think about. Beyond just hospitals, where else could mastering just a few key phrases or concepts really empower you and maybe lower anxiety when you're in an unfamiliar situation?
That's a great question. This deep dive gave you the tools for one specific important scenario. Now it's about taking that idea forward. Practice a little, even just in your head. Stay confident, stay curious, and yeah, always keep learning.